is a 52-year-old male patient with a history of benign prostatic hyperplasia. He presents to the emergency department with the chief complaint of urinary retention for 10 hours. On physical examination, the patient has abdominal distension and reports of suprapubic discomfort with palpation. With the bladder scanner, there's 600 milliliters of retained urine in the bladder. The provider has ordered the patient's daily dose of 0.4 milligrams Flomax and the insertion of a Foley catheter. The equipment that I will gather for the Foley catheter insertion include a blanket and a complete Foley catheter kit. To provide privacy, I will close the curtain completely. Hi, my name is Carrie Ann and I'll be your student nurse today. Can you please tell me your name and date of birth? I'm just going to double check on your armband. Alright, thank you. So I reviewed your chart and see that you have a history of benign prostatic hyperplasia. That can enlarge the prostate and cause that urinary retention you're experiencing. The doctor has ordered me to place a Foley catheter. Do you have any questions? Nope? Okay, thanks. Before we begin, I just want to double check any allergies that you may have to either food or drug. Oh, you have an allergy to shellfish? Okay, well we'll use hydrogen peroxide when cleaning instead of the betadine. Before we begin the procedure, I'm just going to give the patient a blanket in order to keep them warm. And I'm also going to raise the bed to a level that's good for my back. Now that I'm ready to begin the Foley catheter insertion, I will pull down the patient's blankets. I'll have his legs bent out. I'll have my Foley catheter kit placed. I'll use this plastic bag at the end of the bed for my trash. And I will then expose the patient. Opening my kit, I will put on my sterile gloves. Keeping my thumb up for the second glove. I'll then place my drapes. Moving the tray, I will get rid of the iodine as the patient is allergic to shellfish, and I'll be using the hydrogen peroxide. I will pour out the hydrogen peroxide and the lube. I'll hook the syringe to the Foley catheter, take off the packaging. I'll loosen the cap for the urine collection sample. And then I'm ready to begin. So I'll use my right hand, will stay on the patient's genitalia. I'll use the cotton swab and get it with hydrogen peroxide. Swirl. And I'm making sure to go around my sterile field with the garbage. I then have my catheter tip lubed, and I will then insert. Males that have enlarged prostates can be difficult to insert Foley catheters. Keep that in mind. When I see urine return, I'll go a little bit further, and then I will blow up the balloon. I'm going to then collect a sterile urine sample. And on the collection, I'll write the patient's name, the current date and time, the room number, the doctor's name, and any instructions that we have for that sample. I'll then hook the bag to the patient's leg strap and then to a part of the bed that does not move. Once I have thrown out all my trash, I will then place the patient's blanket back on top of them, put their bed in the lowest position, and make sure that the call light is within reach. I will then document that I placed a 16 French Foley catheter with minimal resistance. The patient tolerated the procedure well, and there's now 500 milliliters of clear urine in the Foley catheter bag. The patient's bed was put into the lowest position, and his call light is in place.